Hi, everyone. Just before I start with my formal presentation, I would like to acknowledge that we are gathered today on the unceded and traditional territories of the Squamish, Musqueam, and Tsleil-Waututh people. So today I'm going to talk about barriers to substance use care among young gay, bisexual men, and queer men. And I don't think I have a lot of convincing about why is that an issue to this crowd. I think you're all well aware that young gay, bi, and queer men have consumed substances, including alcohol, cannabis, and illicit substances to a higher rate than their heterosexual counterparts, and that this population face multiple barriers of accessing healthcare. And while research on barriers to access to health services to this population tend to focus on sexual health and mental health, there's actually a gap in knowledge in terms of what are the barriers to substance use care for that population. So I used to be at the BC Center on Substance Use with an amazing group of people. Many of them are actually on this panel and in the room. And we did a study, and what we did is we did interviews with healthcare providers that have experience working with young gay and bi and queer men. And some of them were working as frontline and community-based organization, and a lot of them were also working in healthcare, either as medical doctors or in sexual health clinic or in substance use care. And we did an interview with them to kind of get a sense of what are the help need of that population, including what are their barriers. And today I'm going to present what I would call like half-baked data, which means like they're preliminary data. We're still working and analyzing the data and making sense of them. So we asked them a lot of questions about what are the barriers to substance use care, and we find that those can be grouped under 4 categories. Here they are, and I'll describe them a bit more in details. The barriers that came up the most often were actually health system barriers. So a lot of the people that we interviewed talks that there was a huge gap in services. We don't have a lot of youth-specific services, but also we don't have a lot of services specific to young gay, bi, and queer men, or for queer people in general. As you can see, I'm not going to read the quotes because I believe you can all read them. And also just for time's sake. But as you can see, there was kind of an agreement that there was little services, particularly when we're talking about detox program. We don't have detox programs specific to this population. Also, when we talk to people that were more immersed in substance use care, they talk about the fact that a lot of young queer people that they're seeing, the substance that they struggle with is stimulant. And while there's actually treatment, pharmaceutical treatment for other addiction like opiates or alcohol, for stimulant use, there's actually no pharmaceutical treatment that they could offer. So there's actually not a lot of option to help this population. Another health system barriers that people were describing was delay in care, wait time, and inconvenient hours. So when they have a young man that want to go into detox and they're ready now, well, that can be weeks for them to access those services. And, you know, in many weeks, maybe their life will turn around and we kind of miss this window of opportunity to kind of intervene for that young person. Also, people were saying that not just detox have wait time, a lot of other programs, or programs have inconvenient hours. So it's maybe when services are only offered Monday to Friday, 9 to 5, it might be difficult for young men to skip school or skip work to go to those programs, especially if you know asking time off so they can go see a counselor might be difficult for them to do. Also, one of the other barriers is people say there's actually a lot of within the health system, a lot of homophobia and stigma. Some of it comes from healthcare providers and people working in different substance use care services, but also stigma can come from other participants, particularly in detox program. So there could be a lot of homophobia that can be targeted to them, and it can maybe be hard for people to access those programs and being open about the relationship between their sexuality and their substance use. The second set of barriers I kind of describing as personal and cognitive barriers. The first one that was talked at length by participants in their study is that a lot of young queer men that may actually have difficulty with their substance use or have problematic substance use, they may not perceive the seriousness of their substance use. So they might have a hard time acknowledging that actually their drinking or their substance use is actually have a negative impact on their health and on their life. Another one was shame. So once they may actually see that they have a problem, but actually they may feel very embarrassed, and they may actually, the shame might make it hard for them actually to go talk to their healthcare providers and get that referral for services. So they would prefer to hide or try to deal with this problem on their own. So that was another barrier that was described. Finally, there was kind of an environmental or social barriers that was discussed at length by participants, and that's the one that substance use is so prevalent in the queer community. So that makes it a barrier for people to access services or to kind of stop using substances, because if all their friends are using substances, or if their social life is only going to the bars, going to the clubs, or going to the parties, they might be hard for people to access services because they may actually, well, if I stop using, am I going to lose all my friends? How am I going to connect to other guys? That can be also related to sex. If you're used to only have sex with substance, there was kind of a fear. It's not necessarily a barrier to services, but it's a barrier to stop. So people may actually see, like, what kind of sex am I going to really have now if I stop doing crystal or if I stop drinking? And finally, the last kind of set of barriers was around like syndemic-related barriers. So we know our health system tend to treat kind of everything in silos. So we go there for mental health services, we go over there for our sexual health, and substance use care is in another corner. So when young men struggle with substance use, often there are other issues going on around their sexual health, or more particularly with their mental health. So there's not kind of one shop stop where people can go and receive services that are holistic, and that makes it hard for people to go get help and get access to services in a way that's very efficient for them to deal with the set of issues that they're experiencing. So those are my half-baked data that I presented to you. So, and I have to say, this is not the truth. This is the perspective of health professional in British Columbia. But we are kind of seeing that there are some trends and some important insight that we can draw from this data that kind of can inform different intervention that we can do to reduce barriers to access for this population to substance use care. We need youth and young and queer specific services. We need to build the competencies among healthcare providers. We need education and stigma reduction activities in this community to reduce stigma associated to substance use. And we need to kind of approach health of young gay, bi, and queer men in a holistic way. Thank you so much. There were so many people that were involved, and a lot of them are in the room here, so thank you so much for that. Thank you for my co-author, Rod Knight, and also CIHR that funded her study, and Henry who actually did some of the interview with me. And if you want to chat about this or something else, here's my email.